wanted to take some time because we've had a lot of questions from our students and student leaders on our campus regarding COVID, just some things that they want maybe more clarity on and understand more of the ins and outs about COVID-19. And so I've asked Dr. Wiley to join us. Dr. Wiley is a local pediatrician, and he's also our new Chief Medical Officer for the Hendrick Medical Center. Dr. Wiley, thanks for joining us today.
It's good to be back on the 40. Great 40.
The Great 40. We're glad to have you here today. I kind of wanted to share with you a few questions that these students have had and our student leaders as they've gone through this process of COVID-19. We have holidays around the corner, and so our students are wanting to know maybe some things that they should do to practice to be able to be safe at home and then be able to come back for the remainder of the semester.
Well, that's a great question. You know, one of your leaders, Laura Moore, who is obviously the chairman of the board, she was telling me, you know, the COVID's kind of like you sitting on your porch drinking your latte and you watching the house across the street burn down. He says, what are you going to do? He says, are you going to interact and are you going to help your neighbor or are you going to just drink your latte? And so you kind of think about what can you do going home. Anytime you leave the house, you're in public, you need to have your mask on, unless you can guarantee that you're going to be outdoors with good social distancing. It's also important to kind of limit our gatherings to less than 10 people, and also to be very consistent and be evaluating what is essential and non-essential. If it's non-essential, then we probably should not be doing that. The last thing you can do, and you do think as you go out, is as you return, just be prepared. Be thinking about your fellow students. If you have the opportunity and if you're not feeling well, then you need to let us know. You need to be in contact with your office where y'all can kind of take the appropriate actions. Being virtual is not a bad way to go, but when it comes to being at Hardin-Simmons, it sure is nice to be in person.
Absolutely. And I think what I'm gathering from what you're sharing today is that our students need to just think about others first as they go into this holiday season.
I would agree.
Okay.
That's others first. And, you know, with Hendrick, one of the things we've said is hashtag save lives, save our community.
Our slogan, I guess you could say, is HSU is better together. And we want to make sure we can continue that when students do return.
I think your office has provided great leadership in how to handle COVID and whenever y'all have had exposures. I think Hardin-Simmons has been very focused on doing what's best for its student body and for its faculty and for the community. I've been very impressed with your approach.
Thank you, Dr. Wiley. We appreciate that. It's been a very busy season, off and on, and I think some of the students want to maybe know better what does it mean and things that they need to do while in quarantine. So can you maybe explain to them what that truly means if it's quarantine, and then we also use isolation when those students that may have tested positive. So maybe share with students what they really should be doing.
So I guess the question would be, how do you get to be in quarantine? And quarantine will occur when you've been exposed to somebody with COVID for a significant amount of time, more than 15 minutes in a 24-hour period, less than 6 feet, especially if you don't have a mask. If you are exposed to somebody and those kind of settings, then you should be quarantined, which means you get to stay in your room and you should not be leaving your room. If for some reason you have to leave the room, you should be wearing your mask all the time. There's other possibility that you are going to be that person who is positive for COVID. And that means you get to be in isolation. That means you are behind your locked door and people are sliding food under the door for you and newspapers, and you're there for at least 10 days. If you develop symptoms, you're there for 10 days, and if after 10 days you have no fevers, you're getting better, you get to come out of your isolation. If you have no symptoms, the same time period applies for that.
One common question I've received when having to talk about students being in quarantine because of close contact is what if I test negative? And can you kind of help them understand the potential exposure and then testing negative, the importance of the full 14-day quarantine?
Right. So a test that is negative is, to be honest, not very helpful. If you're in quarantine for 14 days, you're in quarantine for 14 days. And the reason is it's been shown that that virus can be shed all the way up to 14 days. And so that's where that number comes from at this point.
So what specifically with wearing the mask? You know, that's a question students say. Why is it important? Why do I have to wear it? Can you share with our students the importance of wearing the mask, for both people, both parties, I should say?
Yeah. So I think when you talk about wearing your mask and why you would do it, well, one, you want to protect yourself. You know, your goal is to decrease possibly any infection that you could get from it, even though that is not 100%. Our masks are not that good. The other thing is I want to protect the people around me. We don't know the people around us, whether they're somebody who may be immunocompromised or maybe they take care of somebody who is not in the best health or who is elderly. I also like to wear my mask just for our community. It tells me that I want to protect our economy. A lot of times you'll be asked, why do you wear your mask in class? And obviously, one, you can have COVID and not have very many symptoms or maybe no symptoms at all. So we don't want you spreading your COVID while in class, whether it's through a sneeze or a cough onto a tabletop or a desktop. So that's why you're asked to wear your mask when you're indoors, no matter how many people are within the classroom or how well your spacing is.
Great. Thank you so much for that. I think another question that's been on our students' minds are, what about the next semester? You know, we were ending 2020. It's been an interesting year. But as we get to the spring of 2021, what can our students expect? I mean, you know, there's no magic ball. We don't really know exactly what's around the corner, but maybe what are some thoughts that you may have for them to be thinking about for the spring semester?
You think back in March when we first started dealing with this, and our thought process, well, we get to the summer, everything's going to be great, and this virus is going to be gone. And we are now in our third surge, and this third surge is significant. It's resulting in a significant amount of hospitalizations, and our ICU is at capacity. I think the message we want to be is stay the course. Keep doing what you've been doing. I think Hardin-Simmons and the students, the faculty have done an outstanding job in everything they're doing. There is a light at the end of the tunnel, and that light at the end of the tunnel is hopefully the vaccines. Hopefully we'll start seeing those vaccines in February 2021. They have shown great efficacy, nearly 95 to 98%. That will help. It takes at least 60% of your population to develop herd immunity, and right now we're nowhere close to that. So we are ways from herd immunity. The vaccines are going to be what get us to the summer and let us be back to normal.
Great. So there is light at the end of the tunnel. We just don't know how close we are just
Yes,
yet.
that's exactly right.
Understand. Thank you, Dr. Wiley, for joining me today and all the great information that you've given us that we could share with our students. We really appreciate it.
You're very welcome.
HSU family, when you do your part and I do my part, HSU is better together.